in this practice, we're going to explore orifice breathing. So we have, as a female, we have 3 orifices. We have our anal orifice, our vaginal orifice, and our urinary orifice. Males will have 2. So we are going to explore what it feels like, or to engage with a visualization of what it might feel like to breathe through our orifices. And know that you can always come back to these practices after you've done some more of the physical practices, anytime you want. So come into what you think would be the most comfortable position for you. You can either be in sitting, and if you're in sitting, we're going to find our sitting bones, so our pelvis can be neutral. If you need to sit up on an object or on a chair, you can do that. You can do this lying down on your back or on your belly, wherever you feel comfortable. So maybe eyes are closed, or just soften your gaze down towards the floor. Maybe connecting with that pelvic floor breath, getting a sense of ease through the ribs and the belly, or just breathe normally. There's no right or wrong here. So we often don't think about our orifices, so let's see if we can connect with them just for a moment. So let's start with our anal orifice. If you can squeeze and release, just so you know where it is. And then let that relax. And then imagine the breath coming in and out through your anal orifice. Obviously, the breath's not going to physically come through there, but with this visualization, we can start to neurologically connect with the musculature in that area. And with practice, you may even be able to sense a subtle energetic movement there. So we're not squeezing, we're not creating pressure. We want to be relaxed, but we're sensing the breath moving in and out. And you might like to visualize the breath moving in on the inhale and the breath going out on the exhale, or you can do the opposite, breath going out through the inhale and air coming in through as you exhale. That seems a little bit counterintuitive to me, but whatever works for you. Let's stay with this a little bit longer. So feel free to come back to this one or put the video on pause if you want to spend a bit more time. And let's move on to our vaginal orifice. Now you might be able to squeeze and lift as if you were doing a Kegel, and then let that relax so you can kind of sense where it is. You can use your hands and you can find it with your hands, or you can just trust that it's there. So in whatever position you feel comfortable, you can gently close your eyes or soften your gaze. Again, these are all invitations and you can choose what's going to work the best for you. And we're going to visualize, imagine the breath moving in and out of just the vaginal orifice. And I'm going to add, as you're exploring this type of breath, notice if tension starts to build up anywhere else in your body. Sometimes when we focus, we can feel tension in our jaw, and our neck, and in your shoulders, or maybe somewhere else. And if that's the case, just pause for a moment. See if you can let that tension dissipate. Maybe you need to do a little bit of movement, and then just come back and try it again. We're breathing in and out through the nose, the tongue's resting gently on the roof of the mouth. Perhaps visualizing the breath rising up through the vagina as you inhale and flowing back out as you exhale. Let's take a couple more breaths here. And then we can connect with our urinary sphincter. So you can try a contraction here as if, you know, when you really have to pee and kind of you're holding it in, you might be able to feel a little bit of pressure at the front, and then you can let that relax, kind of engaging the bladder or the lower abdomen, and then letting that relax. And then when you're ready, imagining the breath moving in and out through the urinary sphincter. And in your visualization, maybe there's an image of air, breath moving in and out. Maybe there's colors or something else that you imagine. There's no right or wrong way to do this. I know this is the one that I always have a little bit harder time connecting with. So as you explore and practice, you might find that one is easier to connect with than others, and be curious about that. And then maybe try lying in a different position. So if you're in sitting, you could try lying on your back or lying on your belly. So know that you can always put the video on pause, try out another position, and explore it all. So once you've explored breathing in and out, or visualizing the breath moving in and out of each of the orifices, then we can try to pick two. So maybe we start with the two that you feel most connected with. For me, that would be the anus and the vagina. So I'm going to imagine the breath moving in and out simultaneously of both places. So pick two of your choice, and if you only have two, those are the two that you're going to explore. And getting a sense of breath moving in and up, and exhale down and out. We're not creating any active pressure. We're thinking of this more on an energetic level, so it's going to be very subtle. And again, if you don't sense anything right now, that's okay. We're using visualization to help us connect the neurons in our brain to the receptors in our body. Don't overthink it. Just notice what you're sensing or not sensing. It's all good. We all have to start somewhere. Let's take a couple more breaths in the same way. Again, you can use heat or pressure, right? With a heating pad or sitting on a bolster, if that helps connect with the sensation of the pelvic floor with the orifices. And we're noting if the jaw gets tense, or the neck or the shoulders, maybe the hands. And let's just take a few more breaths, wherever you're at. I'm going to sign off, but keep practicing, and I'll see you in the next video.